Welcome back. Well, we're going to continue the conversation on the health sector and the government's policy. We have joining us from the private sector, former Secretary General of the Nigerian Medical Association and Chief Consultant Obstetrician Gynecologist, Dr. Philip Ekpe. Good to have you here.
Good to have you. Thank you very much. It's my pleasure to be here.
You're welcome.
Thank you.
You listened into what the minister said, the new policies that they're trying to put in place in order to retain doctors. What's your initial thought about all that he has said?
Yeah, thank you very much for that wonderful question. I listened to him carefully, and I realized that it seems a missed point, because while he was discussing, he was saying that they were not too interested in whether the doctors who are leaving is their choice to leave. That they are more interested in those who are around, maybe they train more to have more doctors. Maybe he mentioned specifically that probably if you train 7 doctors, maybe 3 will leave and 4 will stay. Unfortunately, I think that they did not maybe take cognizance of the health workforce themselves. What is the driving force? What's making them to leave the country? What are the pull factors and the push factors? Because it's very, very important. That is, these are the people who are, no matter how you paint a car, no matter how a car functions, if you don't have a good driver, it's not going to work. So that is my problem with the policy. The policy seems to window dress the healthcare system. Maybe, okay, fine, you want to digitalize the healthcare system, you want to maybe send more doctors to the rural areas. Which doctors? You understand? Or you want to say, okay, when the doctor leaves Nigeria to another country, that country will send or train more doctors to come back to Nigeria. We must ask a question. Right now, what is the ratio of doctors to healthcare workers? Doctors to Nigerian, to the ratio of doctor to patient. I mean, that is what I know now. I know we're talking about healthcare workforce, right? Right now, it's about 1 doctor to about 10,000 patients. When I was the Secretary General, I mentioned it was 1,000, it's about 1 doctor, about 5,000 patients.
So this
the WHO recommendation is one doctor to 600 patients.
Right.
Now, so it is actually a health emergency that they shouldn't play with. It's not about, they should ask, why are they leaving us? Yes, he stated that quite a lot of them do not want to go, while others are going by choice. No, it's not true. They are not going by choice. They're not going because they love to go or go for shopping. No, they are going because the atmosphere in Nigeria is no longer conducive, particularly with regards to remuneration. So
everything that the minister has said in terms of more training, using technology to support doctors, building infrastructure, you do not think that that is enough or sufficient to prevent doctors from leaving Nigeria?
It's grossly inadequate to prevent healthcare workers.
So what are you expecting then?
How do you mean?
So you said what the government is doing is not enough. What do you expect to see then?
Well, what we expect to see is more like call the healthcare workers, find out why they're leaving, take a survey amongst them, and look at the commonest reason why they're leaving. And it's not a rocket science thing. Everybody knows why healthcare workers are leaving. They are leaving for a better life, because what they are having here is not adequate. I'm not trying to say that the other issues are addressing in terms of facilities, the equipment, and the rest of them is not important. It's very, very important. But you can imagine that no matter how, like I said, no matter how you equip the hospital, you still need the workforce to handle those equipment. Unfortunately, the reason, in short, most of the persons that left really do not want to go if the situation was good enough. And the primary reason, the first major reason why they are leaving is because the pay is very, very poor. So, when you compare to even the federal government policies, like the other day, 300% increase in the judiciary salary, you think about all the different expenditures. I mean, if they can have a special package for NMPC, for CBN, for security maintenance printing, what is wrong with healthcare department, where that is very crucial in handling the healthcare delivery of the country? But
you're talking about people that work for government hospitals, because in the private sector, you cannot really mandate a salary amount. Right? Well,
it's also, beyond salary. If you also look at the private sector, they are not even supported by the government. You have Bank of Agriculture, you have Bank of Industry, but there is really no health bank to say, okay, this is what we are going to use for facility. Rather, there are multiple taxations, both on the public doctors and even on the private sector. So the support is very, very poor. I'll tell you, there are still very private sector settings that are closing down their hospitals and leaving to the outside the country where the promises are high. I'll give an example. I mean, if, for instance, I earn 500,000 naira a month, and another country is offering me 5 million naira a month, and they will pay my ticket and pay for my vacation, why will I stay here? We're not even saying give us exactly what they're giving them, but make an improvement. Well, without really being, I'm not a spokesperson of NMA, but yes. I'm in a position to say, I know what is going on. NMA has been making demand, asking that, look at the inflation rate, look at what is going on. These are the reasons why these people are leaving. And government, can we increase the salary by 200%? They're not even negotiating. The last time they did was about 35%, which is nothing, I'm not trying to say that it's only remuneration. Another reason why people are leaving is insecurity. The government of the day should try to keep insecurity. I'm sure you're aware that some days back,
yes.
There's some medical students, about 20 of them, traveling to Enugu for a program, were kidnapped in Benue State. I mean, such persons, if they are released, you think they're going to stay in this country anymore? I'm sure you're also aware that there is a particular doctor in Kaduna State that has been in captive for the past 7 months. Yes. I mean, this is a mother and, a mother, a wife, and with children. I mean, so these are the things that should be addressed. Apart from that, again, if you look at it, the unemployment rate is still very high. You are saying we don't have enough doctors, but those who are available, you are not even creating vacancies for them to be employed. I was discussing with a young doctor the other day. He has passed his primaries for residency in the past 4 years, but they did not even employ. What the federal government is doing is replacement. Oh, if this one leaves after this one finishes or leaves us to diaspora, they employ to replace that one. Right. How about the teeming population that's increasing? You need to also match the employment to that teeming population, but they close new employment rather than doing replacement. So if you look at it, the summary of it is that this policy will not reduce the brain drain among healthcare workers.
So that's one of the reasons why I asked the minister how much collaboration it has between his ministry, between the government and associations such as the Nigerian Medical Association. You were once their secretary.
Yes.
So you reckon that you don't have that much working together, because you can be making policies for people and the people you're making policies for, it's something else that they need.
Yes, there's a difference between cordial relationship and really that we are all sitting down on the table to really look at these issues objectively. Of course, if there were really proper collaborations, there won't be things like industrial action and all the rest of them. So the collaboration is quite poor. The unions, both nursing union, doctor association, and the rest of them, they sit down, bring up issues, and look, these are the main problems, the myriad of problems affecting the healthcare system in the country. Not just on remuneration, but government plays with it, discuss with you. At the time that you have given them maybe ultimatum, that is when they now start discussing, when it's probably about 2 to 3 weeks of that time, and there is nothing that can be tangibly done within that period. So I'm looking at it that the government of the day should maybe rise up to the occasion to say, look, I mean, you can't even come up with this policy without involving I'm not sure, I'm not aware that NMA, NAM, and maybe Joysu and Co. were involved in this particular decision. But just get me right again. I'm not saying that it's a bad policy. There is nothing wrong with painting your house. Right. There is nothing wrong with putting television. There's nothing wrong with digitalizing your house. There's nothing wrong in sending doctors to the rural areas. Right. There's also nothing wrong with maybe inviting the doctors who have acquired knowledge to come back to the country. But would that solve the problem of the primary problem of inadequacy of healthcare workforce? I've just told you that WHO recommended 1 doctor to 600 patients. Nigeria in the last 4 or 5 years have reduced even from 1 doctor to 5,000 patients, about 1 doctor to 10,000 patients. It is a health emergency that needs to be addressed by the nation. Okay,
if it's that bad, why haven't you left? Why are you still in Nigeria? How are you coping?
Well, if you look at it, maybe I'm not staying because it is very rosy. It's not everybody that wants to leave. It's not because the government have been doing so wonderfully well to me. Probably I have other issues that could hold me down, and that is why I'm not leaving. Not because if I have an opportunity and all those issues are not there, that I will not leave. And moreover, not everybody will leave. As you can see, as a past Secretary General, I see myself as a stakeholder in health in this country. So why should I leave it? If I leave it, that would send a very terrible message. So some of us are forced to say, because of the positions that we are occupying or have occupied, you know, to be able to join the government and to be able to agitate, you understand, and probably negotiate, you know, advocate for a better healthcare delivery in this country. Some persons have to do it, and we choose. I'm among them that chose that we are going to do it to make sure. I mean, the Minister of Health, the Economic Minister of Health and Social Welfare just left, and you invited me. I'm sure he's listening. He's going to hear, and he's going to look at it. Yes, what they're doing is good, but there is a crucial problem to address. You have to address remuneration, insecurity, and unemployment of the healthcare workforce. Thank you.
What specific changes would you expect? Or again, when you look at people that are making policies, what would be your recommendations as you speak to them, you know, here from the studio?
Yes, what I recommend is that when you take a decision to make a policy, or you want to, you know, first of all, just like every other situation, you have to do a survey to find out.
He did say they did some surveys.
Yes, but you see, the issues that the survey were from general people. You have to look at those who are, maybe you take survey from patients, and you take survey from the healthcare workers. I mean, not just the community healthcare extension workers, but medical doctors, nurses, pharmacists, and across the spectrum, and then find out what is the major factor that is making them to leave. And I'm telling you that even NMA and other associations have done such survey, and they are aware. And I'm telling you that one of the major reasons, apart from poor facility, is remuneration, insecurity, unemployment. Then before I talk about the work environment is quite poor. You see, Nigerians are resilient. It's not because, yes, the training is good. You know, why Nigerians excel there is that when you have done when you have to operate in a situation that is not adequate, not good enough, and you find yourself in a situation that almost everything is provided, you don't have to bother about fuel, about economic issues and the rest of them, you know, or light, you know, you will excel. And that is why Nigerians excel. No doubt the country, the training of doctors, the training of healthcare workers in Nigeria is very, very good, you know. And this is more because of individuals. We pass down the training. It's not the buildings, but the institution. And we are the institution that pass down the training to others. And then because of the Nigerian by nature, attempt to survive. They are intelligent people, they are smart, and so when you teach them, they get it, and they work hard, even within Nigeria. It's not like if they stay, they cannot succeed. They will. But of course, when you realize that you can succeed better somewhere else, and of course, the factors are not just dependent on them. You can provide good road for yourself. The equipment, look at it again, the price of drugs have skyrocketed vis-a-vis the forex. You know, so the healthcare is no longer affordable by the common man in this country. These are the issues that this government should be addressing. You understand? Not just the equipment, not just these issues that the minister mentioned. They are fundamental issues.
Right.
Yes, that we bring healthcare delivery to the people of Nigeria. First of all, how do you address the Japa syndrome? It's not by this.
Okay.
I believe that it's by addressing remuneration, addressing insecurity, unemployment, yes, good working environment. And of course, well, there are things that are beyond just the Minister of Health. It depends on now the president, the economic team, to make sure that Nigeria gets better so that things are affordable.
Right. Do you have any final words?
Well, my final word is that while the government are making policies, or they should involve the stakeholders, in those professional areas, and having done that, they should also make sure that it doesn't end at policy, but they should make sure that give themselves a timeline and a target for it to be implemented, because we have heard about you asked that question.
Yes,
you have
timeline,
heard about
yes.
policies and
yes.
policies and policies that were never really implemented, and we get back to the same place. Nigerian population is increasing by the day.
Yes.
We need healthcare workers in this country. It's not about those who want to go should go. There's their choice. No. Yes.
Well, he did say that they would want to retain them, but you cannot force people not to chase their dreams.
Healthcare workers' migration is as old as time. People move for different reasons. But this time around, I'm telling you that majority, 80%, are moving because of poor working condition. The working condition, not just the facility, but even the remuneration and even the insecurity. Then, of course, if I'm not employed in my country and I'm well qualified. Do you expect me to remain here when I lie down in the comfort of my bed and through Zoom, through online, I get an interview and they pay my ticket and I come over and they build a house is waiting for me and I have all the equipment that I need and I'm well paid and I can take care of my own immediate family and my extended family? Come on, I mean, let's look at it. These are the core issues that should be addressed. And I think the Minister of Health, the Coordinating Minister of Health is listening to me, the government is listening to us to say, look, yes, what we are doing is good enough, is commendable, is adequate, but there is still a major, a critical point that they should address if they are going to succeed.
The way you sound, you don't sound like you're confident that all of these problems will be overcome in the next few, because I did ask him in the following, how long we will see, you know, the impact, when we will see the impact of all of this. You're not confident?
No, not at all. I don't have confidence, because if you look at it, it is this same Nigeria that was involved in saying that they signed a pact that the minimum percentage of budget that should go to health is 15%, isn't it? But yes, the highest they've gone is 7%. And most of the times, the monies are not even released up to that 7%. So how do we expect to achieve? What of insurance, health insurance, so that people do not pay, with difficulty from their pocket? We still have less than 5% coverage. What happened to the bill for the mandatory healthcare insurance? What happened? What are they doing to make sure that almost all the Nigerian citizens are covered by health insurance? As it is, if you don't have money and you're sick, then you're left to die. The country does not care for you. That's what it means. Thank you. Yes.
Thank you so much, Dr. Philip Ekpe, for joining us.
It's my pleasure.
Thank you.
Thank you.
That's the much we can take on this edition of This Week Today. Thanks to our production team here in Abuja, Lagos, and London. Do join us again the same time next week for an exciting edition. I'm Constance Ikoku.